Hello, everyone. Today we are going to discuss iron deficiency anemia in young animals. Specifically, we will explore why piglets are uniquely susceptible to this condition compared to other species. Iron deficiency anemia is characterized by a decrease in the number of erythrocytes and/or the hemoglobin content. As a result, the animals grow very slowly, become weak, and reduce disease resistance. The disease most often occurs in piglets aged from 5 to 21 days. It can also occur in other animal species, but significantly less frequent. Calves can get sick from birth up to 3 months of age. However, their symptoms are usually less severe than in piglets. Iron deficiency anemia is the most prevalent form of nutritional deficiency anemia in veterinary medicine. In turn, the causes of nutritional deficiency anemia are primary dietary deficiency and poor absorption in the gastrointestinal tract. Primary dietary deficiency happens when the animal's diet does not contain enough essential minerals and vitamins, such as iron, copper, zinc, cobalt, vitamins B12, B6, folic acid, and protein.
Even if the diet is balanced, the body may not be able to absorb nutrients from the intestines. This occurs due to gastrointestinal diseases, chronic enteritis, or malabsorption syndrome. pH imbalance. Some minerals require a certain acidity in the stomach for proper absorption. Now, let's consider the features of the etiology of iron deficiency anemia in young animals. And let's start with piglets. Piglets are born with limited iron reserves, only about 50 milligrams, because the placenta prevents efficient iron transfer from the sow. They grow very fast and need 7 to 10 milligrams of iron daily. However, sow's milk is naturally low in iron and providing only 1 milligram per day. Low gastric acidity in neonates significantly impairs iron absorption. Furthermore, in modern indoor facilities, piglets lack access to soil, preventing them from obtaining supplemental iron through natural rooting behavior. Now, let's look at the etiology in calves. The primary factors include an exclusive milk diet and a lack of roughage. When calves are fed only milk for too long or denied access to hay and grain, they simply cannot meet their rising iron requirements. Beyond diet, we must consider two other critical factors. First, rapid growth. Modern large breeds grow so fast that their fetal iron stores are quickly depleted to produce the increasing volume of blood. Second, gastrointestinal diseases. Any inflammation or disorder in the gut reduces the absorption of nutrients. In these cases, even if there is iron in the diet, the body simply cannot take it in, leading to secondary anemia. Primary iron deficiency is rare in foals because they usually have sufficient stores at birth and start nibbling on grass or hay very early. However, anemia can occur under specific conditions. The most critical is neonatal esoerythrolysis, where the foal's red blood cells are destroyed by the mare's colostrum. Additionally, we often see anemia caused by heavy parasite loads or chronic infections, which interfere with iron metabolism. Even gastric ulcers, which are common in young horses, can lead to chronic blood loss and subsequent anemia. Clinical symptoms in piglets typically become visible between the 7th and 10th days of life. The most classic sign is marked pallor, a distinct paleness of the skin and mucous membranes, which is a direct result of low hemoglobin levels. The body temperature usually remains within the normal range, which helps us differentiate anemia from acute infections. However, the pulse and respiratory rates are significantly accelerated. You will observe tachycardia and tachypnea because the heart and lungs are working harder to supply oxygen to the tissues. Because of this, the breathing is often shallow and labored. As the condition progresses, we observe significant physical changes. First is growth retardation. Affected piglets lag behind their litter mates and may show signs of emaciation. The skin and coat also deteriorate. The skin becomes dry and wrinkled, losing its healthy pink color to a dirty gray tone. You will also notice that the bristles become dull and rough. Over time, the hair coat often develops a characteristic yellow-brown tinge, which is a classic visual indicator of chronic iron deficiency in a clinical setting. In advanced stages, anemia leads to serious systemic complications. First, the gastrointestinal tract. We frequently observe digestive disorders, especially diarrhea. Next, the respiratory system. Secondary bronchopneumonia may develop. While less common, it significantly worsens the animal's condition and usually indicates a poor prognosis. Finally, in severe cases, look for edema. Swelling of the head and forequarters is a critical sign of heart strain and low blood protein levels.
Anemia doesn't just change how the piglets look, it significantly changes how they act. First, look for lethargy. Because their blood cannot carry enough oxygen, these piglets have very low energy. They move slowly and spend most of their time sleeping. Second, you'll notice a reduced appetite. They lose interest in feeding and stop competing with their stronger littermates for food. Because of poor circulation, anemic piglets feel cold even in a warm environment. They will press against each other in groups to try and stay warm. These behavioral changes are often the first red flags a farmer or vet will notice first. Now let's look at the clinical signs in calves. First, the timing. Anemia usually occurs from birth up to 2 to 3 months of age. In terms of severity, the symptoms are generally milder compared to the acute cases we see in piglets. The most common signs include a noticeable paleness of the mucous membranes. You will also observe a specific behavioral sign called pica. This is when calves start licking walls or eating soil as they instinctively search for missing minerals. Finally, just like in other species, the hair coat becomes rough and loses its healthy shine. Laboratory diagnosis is essential to confirm the transition from subclinical anemia to clinical anemia. A definitive diagnosis is made when hemoglobin levels fall below 70 grams per liter and the total number of erythrocytes drops between 2 and 3.5 tera per liter. Additionally, serum iron levels will show a significant decrease, dropping below 70 micrograms per deciliter. When examining blood smears, we look for 3 key morphological changes. First is anisocytosis, which is a variation in cell size. Second is poikilocytosis, meaning the cells have abnormal shapes. Finally, we see hypochromasia, where the erythrocytes appear pale due to low hemoglobin. When making a diagnosis, we must evaluate the clinical history and environment. First, consider the age. Most cases appear between 7 and 21 days old. Second, examine the housing conditions. Animals kept in indoor confinement, especially on concrete floors with no access to soil, are at the highest risk. Finally, always check the prophylaxis history. Ask if iron dextrin was administered at birth. If this step was missed, iron deficiency becomes the most likely diagnosis. During the physical examination, we focus on 3 primary indicators. First is pallor. We must carefully check the skin and mucous membranes for distinct paleness. Second, observe the respiration. Look specifically for thumps, which is the clinical term for labored, jerky breathing. Finally, evaluate the vital signs. A diagnostic hallmark of anemia is finding tachycardia, or a fast pulse, while the body temperature remains within the normal range. These signs, combined with the animal's general appearance, confirm the clinical state of the patient. To finalize the diagnosis, we rely on the gold standard, laboratory confirmation. This begins with a complete blood count, often referred to as a CBC, to evaluate the overall state of the blood. Next, we look at the biochemical profile, specifically checking serum iron levels. A value below 70 micrograms per deciliter is a definitive indicator of deficiency. Finally, we examine the blood smear. we look for classic morphological changes: anacytosis, poikilocytosis, and hypochromasia. To ensure an accurate diagnosis, we must distinguish iron deficiency anemia from other conditions with similar clinical signs. First, we rule out porcine erythrocytosis caused by Mycoplasma suis. Unlike iron deficiency, this infection typically presents with a high fever and jaundice. Second, consider internal hemorrhage or internal bleeding, which causes a sudden onset of anemia due to acute blood loss. Third, we must evaluate for vitamin E and selenium deficiency, which primarily affects muscle function but can mimic general weakness. Finally, we consider copper deficiency, as copper is essential for proper iron transport within the body. Identifying these differences is key to choosing the correct treatment protocol. In addition to medical treatments, we must consider environmental management. In organic or low-tech farming systems, providing access to natural iron sources is a practical strategy. By placing sterilized iron-rich soil or clean turf in the creep area, we allow piglets to exhibit their natural rooting behavior. This provides a supplementary source of oral iron that can help maintain hemoglobin levels in a more traditional setting. Proper hygiene and sanitation are essential to protect weakened animals from secondary infections. Also, we must prioritize umbilical care. Ensuring the umbilical cord is properly disinfected at birth prevents acute blood loss and the development of omphalitis. Preventing these complications is vital, as any infection or inflammatory process will rapidly worsen the patient's anemic state. Temperature is very important for anemic piglets. Because they have less oxygen in their blood, their bodies are weak and very sensitive to the cold. So keep the creep area warm. For newborns, the temperature should be 32 to 35 degrees Celsius. Use heat lamps or heating pads. This helps the piglets save their energy, so they can grow instead of just trying to stay warm. Colostrum is the first and most important step, so make sure every piglet gets enough colostrum in the first 6 to 12 hours of life. Colostrum provides globulins needed to build the heme complex and support the immune system. If a piglet does not get enough colostrum, it will be too weak to make healthy red blood cells. For treatment, our first-line drugs are injectable iron complexes. The most common preparation is iron dextran. This drug is very effective because it is absorbed through the lymphatic system. From there, it is safely transported to the bone marrow, where the body uses it to produce new, healthy red blood cells. It is the gold standard for treating iron deficiency. While iron dextran is the classic choice, we also have more modern options. Moving to our next drug, we have gleptoferrin. This is a high-tech colloidal solution. The main advantage of gleptoferrin is its higher bioavailability. This means the body can use more of the iron, and it is absorbed much faster from the injection site. For a fast-growing piglet, this rapid absorption can be a significant clinical advantage. To stimulate erythropoiesis, iron is often combined with vitamin B12 or cyanocobalamin. It is a vital coenzyme required for the proliferation and maturation of red blood cells in the bone marrow, and vitamin B6 or pyridoxine, which is a necessary coenzyme for the first step of heme synthesis. Vitamin B9 or folic acid works with B12 to ensure the cells divide properly. A deficiency leads to megablastic anemia, large non-functional red cells. Vitamin C or ascorbic acid greatly enhances the absorption of oral iron by keeping it in the more soluble ferrous state. Vitamin E and selenium, while not direct blood builders, they protect erythrocyte membranes from oxidative hemolysis, especially after iron injections. To make our iron therapy more effective, we must include specific trace elements. Copper is necessary for the function of ceruloplasmin, which moves iron from storage sites to the bone marrow. Without copper, iron stays locked in the liver and cannot be used to make blood. Cobalt is the main building block of vitamin B12. By providing cobalt, we help the body produce its own vitamin B12, which is essential for healthy red blood cell production. Manganese acts as a cofactor for enzymes involved in red blood cell production and general metabolism. To conclude, iron deficiency anemia is not just a nutritional problem, it is a critical challenge for piglet survival and growth.
Thanks for watching. If you found the material interesting and useful, please hit the like button and subscribe for more videos. See you soon.